happened when the first United States state attempted to decriminalize small amounts of hard drugs. That's what we call Measure 110, and it failed miserably. Here's why. Measure 110 was signed into law in Oregon in February of 2021. What it was supposed to do is make small amounts of hard drugs a civil violation with a $100 fine that would be dropped if individuals called a treatment hotline. Easy peasy, right? Also, it took tax revenue from cannabis sales and was supposed to divert that into treatment services. Great idea, right? So we have to understand the backdrop first, because the backdrop matters. Measure 110 was not born out of a pro-drug mentality. It was born out of exhaustion from a system that isn't working. Overcrowding, addiction rampant everywhere, jails and prisons and institutions turning into detox centers, not enough services. Oregonians were exhausted. See, the opioid epidemic shifted public perception in a big way. Addiction continued to affect suburban, mostly white neighborhoods. Prescription opioids blur the lines between criminal and patient. Overdose deaths surge despite aggressive punishment. So we come up with this cultural twist that if punishment isn't stopping overdoses, maybe punishment isn't the solution? And this will have to be another video, but Portugal became the North Star of decriminalization models. We just really missed the mark of what Portugal did that worked. See, what the internet heard, what public healthcare advocates heard, what Oregon heard, is that Portugal decriminalized substances and overdoses went down. But we forgot these key things. Mandatory intervention, cultural differences, universal healthcare, a pre-Hayron era supply, access to treatment solutions. Additionally, also, to be fair, the Rona was taking off at that time, and we just went into emergency thinking. Jail is unsafe, social services collapsed, overdoses skyrocketed. The political climate in Oregon was prepared, was ready for Measure 110. But here is what Measure 110 assumed: that people would actually want and seek help. That's your big problem. Number two, that treatment services capacity would escalate quickly, that police would intervene in a meaningful way. They didn't. That social norms would hold and that the drug supply would not get worse. Fail. Policy actually removed the consequences before the services even existed. We also assumed self-motivation in a disease that's marked by lack of internal motivation. We treated Fent era addiction like Hayron era addiction, and we confused non-punitive with non-intervention. Is this adding up to you? There was a huge assumption here, the same assumption we have with 7-OH, that if we remove barriers and stigma, that people will make healthier choices. Because it happened in Portugal. But here's why Portugal worked. Portugal decriminalized substances for personal use while still keeping large quantities illegal. It is mandatory intervention if you are caught, and they have these services to give you if you are caught. You are still stopped, your substances are still confiscated, you are still required to appear before a government panel, and you will have to follow through on the intervention. Portugal set up the services before they signed the bill. Universal healthcare, detox beds, long-term inpatient, long-term sobriety and recovery houses, job services, reintegration, wraparound mental health services. We do not have these things in the United States of America. What we have are insurance barriers, long-term waiting lists, detox without follow-up, no housing, no employment pipeline. You can't divert people into services we don't have here. I could go on and on here. America is deeply resistant to forced treatment. We are very focused on an individual's rights and autonomy, even when that person is actively unaliving. Portugal's system relied on mutual trust between the government and the social system. We don't have that, but I wonder why. Measure 110 failed miserably for more reasons that I can detail here. Less than 1% of individuals who actually received a citation had the hotline number or reached out to the hotline. The cannabis tax revenue went nowhere. We did not have services set up for individuals to reach out to, and police, they were mostly hands off. What do you guys think? Are you surprised? What are your opinions on decriminalization in states or nationwide in the United States of America? I am interested to hear your opinions. Let me know, drop it down in the comments, and I'll see you on the next one.